Hello, America. How are y'all doing today? Oh my God. Whew, Jesus. Excuse me. For a lot of y'all that don't know, I have a really bad neck that should be getting operated here on next month. But I'm glad you all tuned in today. There's a lot to talk about. I don't know really where to begin. Well, yeah, I do. Basically, how do I say this? America really needs to start giving a fuck right about now, or giving a damn about what is going on with our country right now, because we are losing many battles on many different levels. And I want to point out one or two of them today. First off, I want to mention that I spent some time and reviewed the meeting, I guess they had. I think it was with the Nursing Association. It was the National Nurses Union. They had a little meeting in which a lot of nurses came on, and they, talked about different things that dealt with their issues and dealing with COVID. And chief among those issues was the fact that they did not have enough PPEs. And this is, this meeting was taken, I think it was just before Thanksgiving. And we've been in this for 10 months, and they're still saying that they don't have enough PPEs. And mind you, there was this big brouhaha or rouge in actuality when it comes to all these governors and everything, and the federal government trying to acquire different PPEs and everything. And I remember how they were saying that, at some point, I guess it was in June or something like that, that they now have adequate stockpiles of the PPEs, that, and they will have enough to in an event of a surge and everything. But I don't know. That might have been the case, but evidently they forgot to keep up that supply level because according to the nurses, they said that 80% of the hospitals don't have surge capacities levels of PPE. That means they are hurting for PPE right now because, we are, most hospitals are at 75% or higher capacity in terms of ICU bed units capacity. Some hospitals have actually tried to request some of the asymptomatic nurses or hospital staff to come back in to work. The unions right now are trying to fight that. I'm not sure the exact number, but if I'm not mistaken, between 400 and 500,000 nurses or hospital staff have contracted COVID-19, and over 2,100 staff have died. 2,100 hospital staff have died from COVID-19, and this is just this year, 10 months. 2,100 hospital staff have died from COVID-19. That is an insane amount of people that have died from COVID-19. And that, as we look at that, as you think about that number, think about too the fact that most of these people were wearing PPEs in the sense of these masks right here. most of them were wearing these stuff, surgical masks. Surgical masks, I don't even care if they were N95 surgical masks. They're not going to do anything to prevent COVID-19. Let me qualify that. They're going to do very little to prevent you from contracting COVID-19. As I've mentioned to you before, this would be, if you were to equate your protection to the protection of like password security on your computer, this would be weak password protection for your credit union account. This is weak password protection. You want to go with, I don't even know, I don't have my, I do. This is strong password protection. You know what I mean? So you would be less likely to catch the virus if you were to wear something like this. Now, the problem that nurses and hospital staff are having, the PPE that they are getting are along this level, which again is inadequate. That is why you have 400,000 to 500,000 staff, hospital staff, to catch the virus. And you had 2,100 hospital staff die. They perished because they had minimum level protection. And even if they had the minimum level protection, they had to wear the minimum level protection for the entire shift. Right now, probably, I don't know the percentage, but a great many, too many of our hospital staff have to wear the same PPE for their entire day. And as I've said many times on this channel, this PPE is single use only. That means that when you prepare to go into a patient's room, you are to then don a mask. And then once you leave out of the patient's room, you have to take the mask off and throw it in one of the red whatever you call those things, red basket, so therefore that the contaminated item does not, you don't have a cross contaminations. You don't want to be a doctor and have to wear this for the whole shift and then go from patient and then come out of the patient's rooms and now go into the hallways and everything and mingle around with your patients and your staffs and other people in the hallways. You don't want to do that. You don't want to take this. You really don't want to have any clothing article that is exposed to any of the air that's inside the room. That's why a lot of times they have a negative air pressure room, so where the spurs or whatever, the spores from the coronavirus are not able to, sprout up in the air, to populate amongst the air or in the air that's in the room. So you cannot wear one of these for 12-hour shifts. A lot of these workers now working 10 to 12-hour shifts because they're so short-staffed. A lot of people are saying that they're not going to work in such conditions and they're quitting. I mean, I actually had a niece of mine that I told that actually graduated from nursing school last semester, and I told her that she cannot go into nursing. I mean, she cannot go and she can go get some other job right now, because I don't want her to go and be a nurse, because these nurses not the nurses, but their supervisors don't give a damn about the nurses. And then those supervisors are going to put my little niece into some bad situation that she don't know shit about, and she's going to end up catching the corona. She's going to end up bringing it home to the rest of our dang on family, and then we've been wiped out just because of some stupid stuff that some dumbass manager in operations is neglectful in getting the proper PPE or getting the proper instruments or whatever um, to keep the hospital staff safety. And we got a dumb president and leadership that is not doing what is necessary to prevent or to prevent the cases from the exponential growth that they have had. So no, she could not do it. And many people that were employed in the industry as well, they're leaving, or what they're doing, they're saying, okay, I'm going to another practice to where our caseloads are not so big, because you have some hospitals that are stretched, 110% of capacity, and they're making their staff do way too much, and it's creating a lot of burnout, and with the holidays that's coming up and everything, we could be on the brink of breaking the healthcare industry's back because of the high amount of surge that is going to be impacting in the hospitals. Because remember, we have this big old bulge of surge, but we also have flu season that is here as well. And flu season by itself is going to have 200,000 people or whatever in the hospitals as well that are going to need like ventilator services or things of that nature. Because a lot of times the people that are coming in, they have to stay there for 2 or 3 weeks. So it isn't just, come in and they give you a serum and you're good to go in 3 days. COVID-19 isn't like that. It takes a lot longer time for it to be dispatched. So, the nurses are in a very bad state right now. Really, Congress needs to do an investigation to figure out what the heck is going on with the PPE and make sure that the nurses and the doctors and everything are getting the PPE. And they don't need to do a survey. They need to go their behinds down into the hospitals to see what the hell is going on. Make a personal visit and also go talk to the staff, the administrators of these hospitals. And in addition to that, we have to we got to do single payer healthcare. This is ridiculous. It's almost as if this is big business, allowing the COVID-19 to go ahead and propagate through America. This is like a big business move. Okay, yeah, we can have 30 million people affected, so we can have 30 million people have to go through the hospital and everything or have to buy the vaccines, or I don't know, like all of the stocks and everything that are supplying things to feed or to handle the COVID-19 thing. It's just like those rich people will go and invest in those companies just to make money off of our pain. So we got to squash this stuff. And I'm gonna show you right now. The U.S. share of the current infected people. That's the people that are have been diagnosed and are still carrying the disease right now. So this will be recently infected people. The U.S. currently has 29, just under 30% of the population that currently has COVID-19. The U.S. has 30% of it. Now that is a high as of because earlier in the COVID-19 there was the U.S. share was actually 25%, whereas now it is actually 30% or just shy of 30%. So we're definitely getting worse, and you can see that with the 160,000 or 180,000 per day numbers that we're getting every day. There's no wonder that we're now representing 30%, just shy of 30% of the global numbers that are currently infected with COVID-19. And In fact, it's so bad that that our numbers are actually equivalent to the next 7 countries combined. Our numbers currently is equivalent to the next 7 countries combined. So it just goes to show you that that we are in such a dire shape and everything. Um, let's see here if I can get this pulled up. Um, Give me 1 second. I'm gonna go ahead and why is this weird? Um, I don't understand. It's supposed to be up. Why isn't that an option? Interesting. I don't understand why that is. All right, let me open that up on another thing here. I apologize. Um, one thing is just no, it's not working. I have to open up another server or search engine. Um, okay, let's go here. Let's see if I got it now. Okay, cool. Cool. Okay, so um, I don't know. I guess I really wanted to try it. I had to work a little bit to get that. So just want to show you here the numbers as far as the. Open this up a little bit more. All right, so active cases. Right now, active cases, the U.S. has just over, how do you call it, 5 million cases, almost just shy of 5.3 million cases. And that is active cases right now. We have already had about 8 million recovered, and we've had just shy of 273,000 people that appear so far in the U.S. But as I mentioned, with the 5.3 million active cases, the U.S. is currently the U.S. numbers is currently equal to that of the next 7 countries combined. And those countries include, France, Italy, Brazil, Belgium, Russia, India, Poland. All 7 of those are, are nations that do also have high numbers of COVID, but the U.S. Far eclipses everybody. In fact, is equivalent to the next 7 countries, respectively, in total. And that translates to 1 in every 24 Americans has either had COVID or currently has COVID-19. Again, that's 1 in every 24 Americans has had it or currently has COVID-19. We right now have a total of 13.61 13.61 million people that have had COVID-19 in the U.S. thus far. And let's see. What else do I want to mention on this? Do want to give a shout out to everyone that is working on universal health care. This is definitely one of those issues. We need to have universal health care, 100%. And we need to cut out a lot of these bureaucrats out of this stuff because they get paid way too much to trim way too much from the services that we can expect, and also the standards of care that we have come to respect or expect from hospitals and medical services. But again, I asked everyone to take a look around them. I would even call down or visit your hospitals, check and see, or call them, check and see if they have all the adequate PPEs, protections for them, and if they don't have it, call the administrators to figure out why is it that they don't have it. Because I'm actually going to do that on Monday. I'm going to call down. I may even go down and talk to some of our hospital staff tomorrow and see if I can get an interview on camera to see how are they doing on their PPEs, and if they are here locally experiencing the same thing that the nurses was having and or was sharing with us in that news conference that they had. Because if they are experiencing the same thing here locally, that would be a tragedy. And I would definitely want to do anything that I can to help them out. Because even as I'm sitting here right now, though I have this messed up neck, it's like, dang, I wish I could volunteer at the hospital to try to give some kind of relief to the medical workers. But it's like, I have this messed up neck, I can't do basically much of anything. Unfortunately, because it's like a spinal cord injury that I have, so it's like a whole lot of nerve damage that I have. So I can do very, very little, and even the little that I do have that I am able to do, a lot of times that causes a lot of pain. And you will see it. Even it was evident kind of when I cracked my back and everything when the video first started. But that is that. Yeah, I don't know. I think I'm hoping that Biden doesn't come in and is basically does the same thing that Trump is doing. Is a half-assed effort in trying to start to solve this issue. Because we got to realize that we hired a person or elected a person, though he's definitely better. He's definitely would be better than Trump, because Trump just don't care, and it's almost. I mean, it's Democrats really did us in. And it's crazy because they actually re-elected Nancy Pelosi as the Speaker of the House, and it's just like we have to really fault the Democratic Party a lot as well, because if they had done what they were supposed to do in terms of the Mueller report and prosecuting the crimes that were being committed, and doing the further investigations and everything, and really holding the president to the fire, it would have been, another possibility that President Trump would not be currently in office, and we would have had a different commander in chief. I mean, because I would think that Pence would have been a lot better in the handling of this. And being that the Democrats didn't work hard enough to impeach Trump from the actions of the mother of the Mueller report. Um, it's it really you know it really messed us up in this regard, as far as handling this COVID-19 stuff. And I'm hoping that Biden will be a lot better in terms of the, um, the effort to battle it, because again, Biden is a person that, although he wasn't officially part of the Do Nothing Congress, he was a part of the Do Nothing president, at least as far as black people are concerned, um, in the Obama presidency. So I'm hoping that he will be a lot more proactive in getting the proper PPE into the hands of not only our first responders but also the 50. What we had, I think it's like 50. Is it 50 or 35 million um, poor people that we have in America right now? I mean, it's like, it's no wonder that, our numbers are so high. It's because, we have 50 million poor people in the country right now. Um, there's no way that we can defeat COVID-19 unless we do what we can to make sure that the poor people have adequate supplies or adequate supplies to PPE. A person can't, if they're using this, if they're buying disposable, don't buy these. But if they are, that costs money that people don't have right now. I mean, you have these food lines that are miles long because you have 50 million poor people right now in America that cannot afford to have the masks that are necessary for them to save their own lives. Um, because, like, this costs $60, and if you got a family of five, that's $300 and some dollars or whatever, with taxes or whatever. And these things aren't, you know, I, these things are not the most comfortable to wear, but they save their lives. But like I said, a lot of people don't have it, and a lot of people don't know enough about it because my stick channel reaches a very minute, how do you call it, audience. And with the impassioned response to trying to fight COVID, um, I don't think that we will get enough people understanding that they need to upgrade their level of protection. Even with the nurses and everything, they don't want to have this type of protective wear. They want to have a higher level of protection. The same should be wanted by everyone in the public as well. And we also need to have public enforcement of people that are not wearing a mask appropriately. Throughout the country, we had a myriad of public officials or public safety officers or police sergeants and sheriffs and things saying that they would not enforce any of the social distancing or mask wearing mandates that were established by the different mayors or judges or whoever was governing that particular jurisdiction. And to me, I feel as though those people should have been stripped of their rights to serve. They're not serving the community. We're in a biggest. We're in a what do you call it? We are in a pandemic right now, of which we should be literally at a war footing, similar to that China had done, and said no, everybody has to comply with these orders, and the person that is the chief of police or the sheriff or what have you also has to comply. And if that cheaper person doesn't comply, that person should have been removed from their duties, because that is political malfeasance of leadership. And the same thing with the president of the United States. We should have had some sort of way to where the Department of Health or whatever, or CDC and several other federal agencies should have got together and say, for the betterment of our nation, we have to strongly advise that our president be removed from office because of him actually in real time murdering 260,000 people on the way to murdering an eventual 1 million people, 1 million Americans, all because though the other people that were in co-equal branches of government chose to sit on their hands and do nothing and watch everything and just speak only when spoken to about trying to prevent other people, including their constituents and family and neighbors and the like, from catching COVID-19. I don't know. I mean, is it because of the fact that politicians don't have to have a political degree or a degree of political science in order to get their job? The most important jobs in America is the only jobs in which you don't have to have a degree in order to get such title. That's some BS. We have to have people that actually give a damn enough about the subjects in which they're actually professing to govern in. And yet they don't even have a degree in the subject. Many of the people that we have are economists and or business people, and they're only in it for self-interest or political interests or political gains or social gains. They're not in it for the interest of actually doing something for the people or for the nation, or for the betterment of society. They're in it for, again, greed, personal gains, and that type of stuff should be banned from entering into politics. I mean, true, you won't be able to ban it or complete, but in at least the minimum, we can mandate that for anyone to run for office, they have to have a degree in political political science or public administration. I'm sorry, you can't be a doctor if you have a plumbing license. You can't be a doctor if all you have is a plumber's license, a plumber's certificate. You can't go and say, okay, I want to go take the board, and all I have is a plumber's certificate. That wouldn't cut it in being a doctor, and you only happen to operate or work on one individual at a time. Whereas if you're a political person, you're having to work with, especially if you're in charge of federal government, you're in charge of implementing decisions that affect 313 million people every day. And yet you don't have any kind of degree to have any kind of understanding for which of the jobs of which you're being elected to actually dispatch or undertake. We have to change that. We have to upgrade our standards if we want to upgrade the type of leaders that we have to lead us through these such challenging times, such as a epidemic or a pandemic that we're currently going through with COVID-19. So I'm going to leave it at that. Please, everyone, again, upgrade your PPE. Also, you should also be wearing glasses as well, eye protection as well. I'm going to be actually ordering some different ones for myself. I'll be introducing those and probably do a review on those as well in the near future. So please take a look or keep a lookout for that if you're interested. Also, I'm going to be hopefully dropping some more political type videos dealing with different political topics that we need to talk about that isn't being talked about enough in the mainstream media or in the YouTube media. So I'm going to have to cover some of these things. Hopefully, I will be able to do it in the very near future. Um, it all is dependent on how I'm doing. I really have to be feeling good in order for me to do this because um, it's it, because otherwise it would be too dramatic, too difficult for me to do it. If not, so that permits me limited time to actually to do these videos. So I'm hopeful that I will be able to do more before I take my surgery because I'm not sure how long it's going to be for me to recover from that. And from those who don't know, I'm going to be actually having a 3-disc fusion in my neck because of a car accident that I was in. So yeah, it's not going to be fun, and I'm not really sure I'm not sure how long it's going to be for me to actually recover from it and be doing more videos because they actually have to take my throat out and slide it over to the side, take out like 3 of my vertebrae and everything. Then I have to go in there and put the new stuff in, put the titanium screws and everything in there, then put my throat back up in there, and hopefully everything be still working to where I can talk to you. But the more important thing is that I will stop having so much nerve pain that I have constantly all day. That has been absolutely debilitating since I had the spinal cord injury when I had that accident. So yeah. Hopefully, if you could just pray for me. Hopefully, I will be able to make it through and see you all on the other side. But again, until I see you on the next video, I hope that you all be safe. Keep the faith that everything will work out, but make sure that you put forth the effort in making sure that you make it through these trying times, because God is not going to help those who don't help themselves. And you doing the minimum, the absolute minimum to protect yourself in this virus situation is not doing enough to give yourself a fighting chance to where, regardless to how much help God gives you, it won't be enough for you to maybe overcome these viruses. So you don't want to allow yourself to be in a situation to where it's either God or nothing, because it's absolutely too easy for you to do a simple investment and a simple understanding mentally that we are in a very bad situation here, and I'm going to accept enough personal responsibility for me and my family and say that I'm going to self-isolate. I'm going to do all these X, Y, and Z steps that I have explained in other videos to prevent yourself from contacting coronavirus and spreading it for your whole family and everything, because no one knows how a particular person is going to respond to being infected from coronavirus. Unfortunately, right now, I think it was like 80% of those that are dying from coronavirus are those that are 65 and over, but that is 80% of 260,000 people. But there's still, or 272,000 people now. But there is still that 20% of that amount, which is like 50,000 people, that is under the age of 65 and would still die. So that is still a significant amount of people that would die from that age group. And we don't want any person to die, yet alone a person that is of that age group. There was one other thing that I wanted to show that just let me see, got reminded of. Um, let's see. I want to check. What was the other one? What was what was it? CDC, it was John Hopkins. There we go. No, wait. I thought. Sorry. Give me a second. What? What's that? Oh, here we go. I got her. Why does it look weird? Weird. Okay. So, you see, this is all weird. I never seen it. I got to this from a different area, but that's not really why I brought you here. What I brought you here for is to take a look at this, if you could. Matter of fact, what I'm gonna do, let me just switch it over to the second one altogether, so a little bit bigger. Now, if you would look at this for the U.S., the U.S. currently has 34,514 deaths in the state of New York. In the state of Texas, there's been 21,788 deaths from COVID. All of these are from COVID-19. In the state of California, there have been 19,132 deaths from COVID-19. In the state of Florida, there has been 18,442 deaths from COVID-19. In the state of New Jersey, there have been 16,985 deaths in the state of New Jersey. In Illinois, there have been 12,838 deaths from COVID-19. This is all within the last 10 months, people. Within the last 10 months, this many people have died. In Illinois, it's been 12,838 people that have died from COVID-19. In the state of Massachusetts, there have been 10,676 people that have died from COVID-19. In the state of Pennsylvania, it's been 10,234 people that have died from COVID-19 in the last 10 months. In the last 10 months. And with all of this is expected to double. All of this is expected to double in the next 4 months. And it may not be each of these specific ones, but in total, we have 270,000 people in the U.S. that have died from COVID-19 right now, and 272,000. And I expect another 270-some thousand to have perished, by by the end of January. I think even it was on the news. Pretty much the end of January or about the end of January, we're gonna double what we have right now. So we have 274,000 right now. We're going to have about 520 or so. Well, we'll have close to 500,000 by the end of January. So it can be prevented, though, if we take the proper precautions. If people took this a lot more serious. People, you need to stay off of the public transportations. You need to quit congregating amongst your friends, your family, your associates or whatever around the corner. You need to quit going on the Netflix chills. This is so serious right now that it's just gonna. A lot of people aren't mentally capable of handling it right now. And please, people, stop listening to people that are doubters, that things are not that good. Just disassociate yourself with them, people, because what it's going to end up doing is have you being influenced of their idiocracies, and you end up being the one that died, and them being the ones that just be the lucky fool that has escaped, and you being the good and innocent one that ends up dying because you listen to the fool that just saying something just because he a fool and he wants to make you look like a fool right along with him. Misery love company. So don't listen to fools that you have living around you trying to influence you to not wear proper precautions. Disassociate yourselves with fools and allow yourself to live a lot longer lifespan than you would have if you were to be exposed with this virus. I mean, we got 62 million people worldwide that has contracted this virus, and worldwide we have 1,453,128 people that have died from COVID-19 worldwide. That's 1,400,000 people. 1,400,000 of people. 1,453,128 people have died from COVID-19 thus far. And with that total right there, I can guarantee you that America is going to eclipse that one single total right here. By this time next year, America will eclipse this number right here, 1,453,128. We will eclipse that amount right here by the 29th of November 2021. Because of the lack of action, lack of political will, and a lack of political leadership that we have in both the Democratic and Republican parties. My name is Doc Holliday, everyone. I thank you for joining me tonight. Please keep an ear out for me. Please subscribe. You will be hearing a lot more from me in the future. Thank you, and God bless. And keep the faith.